Unit 13, Mental Health. The 5 most common types of mental disorder.
Anxiety disorders, which include obsessive-compulsive syndrome, panic, post-traumatic stress.
Mood disorders, depression, bipolar disorder, substance-induced mood disorder.
Psychotic disorders, schizophrenia, delusional disorder, substance-induced psychotic disorder.
Dementia, including Alzheimer's disease, Parkinson's disease.
Eating disorders, anorexia, bulimia, binge eating.
Key words:
To cope,
Normal,
stress,
Productively,
to suffer,
disorder,
chronic,
substance abuse,
psychotic,
addiction,
preventable,
to quit,
alcoholism,
read,
When a person is mentally healthy, they know their strengths and weaknesses, and they can cope with the normal stresses of life. They can work productively and are able to make a contribution to their community. When a person is mentally ill, they have problems with reality. This means they can't cope with the normal stresses of life, they lose productivity, and they are not participating successfully in their community. A mentally ill person is suffering from a mental disorder. The disorder may be occasional or chronic, lasting a lifetime. There may be ways to limit or control a disorder, but some may need professional help. Related to mental disorders is another very serious health problem: substance abuse, which can lead to mood and psychotic disorders. Substance abuse often results in addiction. One common addiction is to the nicotine in tobacco, caused by smoking cigarettes. Fortunately, tobacco addiction is preventable. Quitting is not easy, but many people do it. Perhaps the most common substance abuse is drinking too much or alcoholism. Many people drink alcohol and do not become alcoholic, meaning their drinking does not interfere with their lives. They do not become addicted, and they can easily go through several days without needing to drink. An alcoholic, however, has a much harder time and may need the help of an organization that helps people with their addictions. Drug addiction has always been around. Drugs like cocaine and heroin can be very dangerous and addictive. Prescription drugs such as opioids and amphetamines are a new problem, and the use of drugs has also led to an increase in crime.
think about it,
anxiety. Anxiety disorders are the most common mental illness in the United States, affecting 40 million adults age 18 and older, or 18.1% of the population every year. Anxiety disorders are highly treatable, yet only 36.9% of those suffering receive treatment. People with an anxiety disorder are 3 to 5 times more likely to go to the doctor and 6 times more likely to be hospitalized for psychiatric disorders than those who do not suffer from anxiety disorders. Anxiety disorders develop from a complex set of risk factors, including genetics, brain chemistry, personality, and life events. It's not uncommon for someone with an anxiety disorder to also suffer from depression or vice versa. Nearly 1/2 of those diagnosed with depression are also diagnosed with an anxiety disorder.